So I thought I would start with you, Omnia. I don't know about you, but I feel I want to weep. Okay, so I feel we are in a really hard place at the moment with climate change. It's being called the greatest con job by Trump and at the UN recently. And we've also seen the dilution of the Green Deal, the European Green Deal. So the Pan-European Commission on Climate and Health, which you're part of, is a really new body. So hopefully some real fresh ideas. So what does it hope to achieve first? And second, how can we galvanize leadership across European member states and institutions so they see the health co-benefits of climate change?
Yeah, can you hear me? Oh, perfect. So thank you so much for having me and for giving us the opportunity to share our work. Before I share what we aim to do as the Pan-European Commission, I want to share why it started. It started this year when we have seen the breach of 1.5 degrees. We've seen the thousands, over 100,000 of deaths from heat-related causes just in 2022 and 2023, but also the devastating impacts of heat, both on physical health, whether it's heat stroke, the rise of infectious diseases that we've never seen before or we've seen return in countries that has been eradicated here in Europe and globally. We've also seen the impacts on mental health, sleep disturbances, stress, anxiety, but also people who are living with mental health conditions and because their bodies are unable to adapt to the heat because of their medication, going straight to the emergency rooms of many hospitals here in the UK and globally. And at the same time, we've seen also how the healthcare systems are the first and the last line defense against these impacts, both in terms of the impact on human life. And a very interesting study that came out last year showed that the climate disasters, as well as the chronic events, have led to over 143 billion US dollars in losses. 90 billion of that is in human loss and over 50 billion is in economic damages. And the ones that are bearing the costs of these impacts are the publicly financed healthcare systems. They are bearing the costs on the infrastructure of the hospitals that are being affected, but also on the emergency care and healthcare services that healthcare workforce needs to deliver, being insufficient and unresilient and lacking the necessary investment they need in the adaptation of the facilities, but also in the mitigation and not being the health sector that is contributing to the problem. And that's why the Pan-European Commission on Climate and Health, we are an independent commission. We are chaired by the former Prime Minister of Iceland, Katrín Jakobsdóttir, and our chief scientist, Sir Andrew Haynes, who has been the leader for climate and health research and action. And as you can see, our co-chair and our commissioners come as former political leaders so that we are independent and maintain our voice. And at the same time, a combination of scientists, people from different walks of life. And our aim is to develop and bring together a set of recommendations that are based not only on evidence, but based on the lived experience of communities, of young people, and also on indigenous leaders that are at the front line of the impacts of climate change on their health and their well-being. We do that by organizing a set of hearings. In each hearing, we listen not only from from ministers, but also listening from frontline communities as well as financial institutions. And in order to develop a set of recommendations, a report that will be launched next year in the World Health Assembly that aims to inform political leaders of European countries and ministers of health to understand how to integrate climate change in their healthcare systems to prepare and to reduce its own carbon footprint, and vice versa, how to integrate health within climate in terms of health co-benefits to climate mitigation, on how to turn that vicious cycle of carbon emissions into a virtuous cycle of well-being.
I mean, I don't want to be cynical here, but do we have too many quangos on climate change and health?
Do you have so many what? Sorry?
Do we have too many quangos, too many organizations looking at climate change and health? Do you think it's a busy space out there? I mean, what do you think you guys, because you only had your first meeting in June,
yes,
and you're going to have your next meeting this month. What are you guys going to say that's different for the skeptics out there to really listen, so to speak?
Yeah, that's a great question. And I always see the climate and mental health, climate and health field. It's actually a growing field. I started working in the field 7 years ago. I was one of 10 representatives of health in the biggest climate conference. And only last year, from 10, we became 1,000 healthcare professionals that are engaged. What our commission brings in is that there's a lot of on the ground efforts led by communities, led by civil society organizations to help communities cope with the impacts of climate change on their health that is accelerating. And we're seeing it in our hospitals, in our communities. But at the same time, we don't see the translation or the integration or even the preparedness of our healthcare systems and our countries to the impacts of climate change on health. We need further understanding on how we can invest in people's health and their resilience to be able to cope with the impacts of climate, while at the same time, the fossil fuel-driven impacts of climate change, we need to transition in a just way to reduce these impacts, to reduce the temperature increase that is devastating our lives and our health. And that's where the Commission comes in.
Thank you. And I really like the idea that you actually mentioned religious groups in there, because they have huge influence. So this whole idea that we need to encourage this inter-ministerial cooperation between the different sectors. So, finance, the role of labor, the role of the healthcare sector, because employers have a role to play with, kidney disease, with the workforce, in the heat. So it's really great to hear the work you are doing. I'm going to move now to you, Simon, because as one of Germany's, largest hospitals in Europe, I think you have over 3,000 beds. So Charity has been tackling its own emissions for many years now. So how prepared are you guys now with this new climate? And are you seeing a shift in attitudes? And also I'd love to hear about, what are your big wins at the moment in terms of emission reductions? And just any successes that you'd like to share with us.
Well, thank you for having me. I'm happy to share successes, but I would like to start with the challenges first. I'm in charge of infrastructure and sustainability at Charité, based in Berlin. And we're not just Germany's biggest hospital, but we're one of the biggest university hospitals in Europe. And when you look at the healthcare systems and its pollution, we're talking about between 5 and 7% of the overall emission of CO2 due to the healthcare sector. And in comparison, this is how much we pollute with air traffic and sea cargo traffic. So when you ask people on the street, they would name probably transportation, and especially air transportation, as one of the biggest crimes against the climate. And the healthcare sector itself is an even bigger polluter. Then talking about Germany's biggest hospital, we have a huge responsibility to change something. And we already talked about how this climate crisis affects us in the healthcare sector in two ways. On the one hand, we're a huge polluter, and on the other hand, diseases change, medications don't work anymore. There's a straight correlation between death rates and temperature. And so we need to tackle this issue. In my point of view, we're doing a lot about the infrastructure and trying to prepare our organization to tackle these challenges. When it comes to the building infrastructure, this is the biggest problem we have, is that our buildings are old, needs renovation, needs investment, and we are a public company or a public hospital, and Berlin is not known for its huge budgets. So we're always struggling between the necessary needs to invest in climate-friendly infrastructure and the needs of our researchers and doctors, and a very limited budget. So, but in the end of the day, this is the main problem we have. Old technical equipment, old buildings, not like old windows, old roofs, all that. But then there are things you can do with less money, and I would actually say that sustainability has become an economic factor. It used to be something that we talked about, and it was nice, and certain groups and certain people were really engaged, and other people were like, "Yeah, whatever. Leave me alone with your green discussions."
Are they still engaged?
They are still engaged, but when just one example. At Charité, we have 3 major hospitals in Berlin, in the city of Berlin. We have 280,000 light bulbs. And if we change them into LED lights, that would save 60% of our electricity costs. And doing that sustainably in the next couple of years saves us millions of euros, and it saves CO2 emissions.
Yeah,
and we could talk about procurement and all that. So I think there are a lot of reasons: mobility, the reason how we, the way we treat food in our hospital, and food waste. There are a lot of things, practical reasons, or practical examples of what we can tackle without having sustainability as being such a huge thing that we're overwhelmed with.
Yeah, so you're tackling it on all angles. I know you're working a lot on reducing gloves in hospitals. We use a lot of gloves in hospitals. And also your policy around food is really interesting, because you have this planetary health diet, which is plant-based. I mean, did patients, find that, did some patients not like that? I mean, how are you dealing with that? Because I know if I was a patient, I like my meat. I shouldn't say that. The climate change panel.
Yeah, we're working towards the goals of planetary health, right? It doesn't mean no meat at all, but it means a more healthy and a more balanced diet, because there is a huge relation between the diet of patients that are vulnerable in the hospital and the outcome of their hospital.
And so just one more question before I move to Jens, because I want to understand, for this to happen, we need green procurement. So how do you judge the green credentials of your suppliers? And then we're going to move on to Jens to tell us how that should be done.
Yeah, he's the expert on procurement. But when it comes to procurement, we want 2 things. We want a cheap price, but we also want our people to be motivated to use less resources, and resources that are better for a circular economy. I mean, the way products are being able to recycle is a huge part of our procurement decision.
Okay. So, Jens, can I say this? The procurement officials are going to be the rock stars of the future, because you guys are going to decide these green credentials. Okay. So tell me, how can being a sustainable healthcare business give a company that competitive edge? I mean, how do you sell it?
Mm-hmm. I think first of all, I think we would be rock stars on very small stages. We wouldn't fill stadiums. Secondly, I would like to say thanks to the audience. I can tell you I've been to a couple of panels earlier this year, and since the EU decided on Omnibus 1 and Stop the Clock initiative, the sustainability sessions have become rather less visited. So it's nice to see a full auditorium. It seems the Brexit had one positive aspect. UK is still interested in sustainability. Thumbs up. But
talk about that. Stop the clock. I mean, I'm worried about it.
But coming back to your question, I mean, I represent a group purchasing organization. We serve about 2,500 sites in Germany, from hospitals to rehabilitation clinics to elderly homes. And actually, there was an evolution when it came to procurement. At first, it was just price. Then it was price and quality. And after that, it was price, quality, and process. So embedding the product into the process. Then, due to COVID, we had resilience. So supply chain all of a sudden became a topic. And now it's also the sustainability element in terms of product carbon footprint. We already heard something about food and nutrition. On that aspect, also because it's driven by big companies, Nestle, Kraft Foods, etc. There's a lot of information available. But when it comes to medical devices, pharmaceuticals, again, is a different topic. But when it comes to medical devices, it becomes extremely difficult for the industry to come up with a article-specific product carbon footprint. One of the reasons is, I'm not saying that the industry couldn't do it, but there's no ISO norm at the moment. There's no DIN that they can go by. So when we lead negotiations with the industry at the moment for our clients, and we ask for product carbon footprint, they always refer to 2026. So next year it will come. I'm afraid it will not come until, there is a norm how you actually define the product carbon footprint for a medical device. And that's what the industry is going to wait for.
And just in terms of incentives that work, I mean, we know these big organizations that do big procurement. Okay, should they have environmental weightings in their tendering process? I mean, to encourage the industry to move in that direction, I mean, you need some sort of incentive, surely, or not?
Absolutely. And I mean, many countries have gone down that route. I think the first ones to really take the lead on that was the Scandinavian markets, where actually, that element has become part of the tender process. I think the same is true for the NHS. I know that Canada is working on it. They're even thinking about rating sustainability element up to 30%.
30%?
Yeah, 30% in the tendering process. I think right now it's about 15 to 20. Germany, we do start seeing it. Again, it's very much based off which product group you're looking at. I hope to see more. But I'm not here to talk about Germany, but we have a federalistic system, so there's 16 different health legislations, state by state. It's not central. So one of the funny things in Germany is that we always refer for best practices outside of Germany. NHS is one. But also Scandinavia. But then because you have 16 different regulations also for the industry, again, it becomes tricky because it could differ state by state how also the tendering process is done. But this is where our role keeps as a GPO.
Brilliant. So we're going to move from Germany to the UK now, and we are in the UK, and we're very lucky to have Koonal with us. So the NHS is probably the first big organisation that has a very strong green plan for itself. And NICE produces so many guidances. So does NICE require an environmental assessment for all or some of your products? I mean, tell us about how your thinking is on this. Because later on, the NHS, I'd love to understand how NICE is going to work with the NHS net zero supplier mission, so to speak. So over to you. Thank you.
Yeah, so the NHS in England has legally binding targets to become net zero, and NICE is here to support that. We have looked into the feasibility of doing environmental assessments in our health technology assessments. When we looked at that recently, we found that the data and the methods weren't there for us to be able to do it consistently. And quite frankly, we didn't have the skills to be able to appraise data and make sure that they weren't biased. But there are things that we have been able to do on the path towards getting there. So one thing that we are doing routinely now is requesting and providing links to companies' carbon reduction plans. So at a company level, we provide that in all of our technology evaluation guidance. And we are piloting, sort of requesting and critiquing and appraising environmental data. So this is, done outside of life guidance at the moment. We've actually found that lots of pharmaceutical companies are really keen to partner with us. They do want their data to be appraised.
They're driving it.
Well, the NHS is by 2028, they're going to require product level carbon footprint information for any company that wants to get a contract with the NHS. And that milestone provides a lot of opportunities for us. So we're working towards that milestone. And the main thing for NICE is that we need any environmental impact assessments to be done in an unbiased and comparative way. There's no point having a life cycle assessment of one technology and a life cycle assessment of another technology if you can't compare the outputs, if they were done in different ways. So where there are efforts to produce harmonized standards, we are contributing to those, and we're trying to, communicate what would be useful for an organization like NICE.
So would you say we're at the stage of just kind of standardizing approaches at the moment, understanding what data you need? It's still really early days, because my big question is, if you have two options, two drugs, say, that are clinically and cost equivalent, okay, or effective, And then should an environmental impact, will that tip the balance, tip the guidance for NICE? That's what I want to understand, from because this is coming into the picture of how we assess products now with these carbon footprints for an actual product, which must be a really hard thing to calculate. I actually don't know how they would begin, but anyway, over to you.
Sure. Yeah. Those scenarios don't come up that often, but when they do, yeah, that would certainly be the way NICE would go. NICE would want to recommend the greener option. In an area where there are no trade-offs between environmental outcomes and cost or human health outcomes, it's a no-brainer that we would want to recommend the greener option. It becomes trickier when there are trade-offs involved. They would be more controversial, and we'd need we'd need even more assurance about the quality of the data in those situations. But yeah, there are things that we can do in areas like anesthetic gases and inhalers where we are, even if we're not feeding them into our value judgments and our recommendations about what should be used in the NHS, we're at least we are acting as an information conduit. We're providing information to help patients and healthcare professionals make greener choices.
And the other big role of NICE, I guess, is how can NICE help minimize avoidable demand for care, restricting the supply of certain things that are not efficient. And also there's an island, I think it's kind of been tinkering in Scotland, I don't know if you've heard about this, where, and the pharmaceutical industry won't like this, but about reusing medicines that the patient brings back to the pharmacy, which has not been opened. I mean, I know a friend of mine who works up in Scotland who's looking at sustainability, is looking at this idea. Pharmacists won't like it. I'm a pharmacist. But tell me what your thoughts are on other ways of minimizing waste in the NHS. I
mean, I think minimizing waste is another no-brainer. And anything that we can do to sort of rationalize the medicines that people use. So we've got a medical medicines optimization program and a guideline for this, and regularly reviewing the treatments that people are taking is really important, because there are many treatments that don't need to be taken, and the demand, unavoidable demand for healthcare is a major cause of environmental harm, and that can be reduced at minimal cost and without any harm to patient health outcomes, which is what NICE is, what our main remit is about.
Thank you so much. So if procurement is the rock star, then healthcare professionals are the saviors. So over to you, Vasilius. So the green revolution needs healthcare professionals. So how best can we engage them, to deal with climate change? And also, I'd like to understand a little bit more about the clinical guidelines that we use every day as healthcare professionals. To what extent are they considering sustainability in them? Is it still really early days? I'd love to hear your thoughts.
It is very, very early days, and you can see only a trickle of green and sustainable thinking into the guidelines. I mean, NICE is one of the most credible organizations in the world producing guidelines. It's not the only one. There are scientific societies, professional organizations, and guidelines, and I have been in God knows how many panels producing guidelines. They take everything else into consideration. The green and sustainable agenda comes at the very end into it, and very little at the end product that we are called basically to implement. When it comes to the healthcare professionals, and you mentioned my European professional leadership role, but I'm first and foremost a clinician. I'm a practicing transplant surgeon at the Hammersmith at Imperial College, a few miles away from here. I believe there are three main issues. The first one is a complete change of culture. And this has to start from day one in medical school. You cannot ask from people to adopt a green and sustainable thinking and culture in their 60s or just before they retire. This has to become not a presentation of moral values, but part of their training curriculum in medical school, in specialist practice, in specialist training, in specialist practice, and later on all the way up to their retirement. This is absolutely crucial if it is to see some real change, because unless people think green and sustainable first and foremost in everything they do, nothing is going to really change. And at the European level, with the organization I lead, we work very hard in this direction. In the European training requirements, we are developing, in collaboration with 41 countries and their national medical associations, the green and sustainable training is an integral part of it from the very beginning to the very end. Not as a set of principles, but as real training in real life. That's the first point. The second point is about a relaunching of the clinical pathways. If you see the way we act now, and you were asking me earlier about paradigms of successful interventions in the green and sustainable direction. The anesthesiologists are one example of it. Other colleagues using high-level technology, radiologists, are another example. But an intervention here and there doesn't make the real difference. The real difference will come when we relaunch and redesign the clinical pathways from scratch. Example, I look after kidney patients, and as you know, dialysis is a life-saving procedure for them. I mean, life-saving treatment. For the last decades, nobody has seen anything that has to do with the redesign and the redevelopment of the clinical pathway related to dialysis. And every single step of it is a massive burden to the carbon footprint. Identification of patients, when you're going to put them on dialysis, what kind of machines you're going to use, what kind of dialysis aid you're going to use, what kind of medications, how long they're going to stay in the hospital, transportation, options to have dialysis at home. Nobody has seen the package, relaunch it in the context of green and sustainable. So I don't believe to an intervention here and there. I believe to redesign from scratch. And the last point, and you asked for this about the involvement of patients. I believe it is absolutely crucial that patients will play a very crucial role in this redesign and relaunching of the clinical pathways. We have seen that again and again. The most crucial advice for anything new in our practice doesn't come from the clinicians, come from those at the receiving end of our practice, which are our patients, basically.
And I'm so glad you mentioned green nephrology, because it's a huge movement. And I only know because I did a report on climate change and its impact on cardiovascular, renal, metabolic diseases. And they're really looking into it. It's really impressive, actually. And this is how it's going to be done. It's going to be discipline by discipline, bit by bit until we get it right. So it's hugely important. I think I'm going to ask one question to the whole panel now before we open to questions. So kind of strategies on dealing with reluctant people who don't really get it, the climate change and the co-benefits of health. So maybe in a sentence, starting with you, Simon, what would be your main strategy to say, just get out of the room? I mean, what's your strategy?
That's actually a really good question. And being in charge of such a topic for 24,000 employees it doesn't make it hard. I think you need a core group of people that are very dedicated from different fields and to contribute and to learn from each other. And I think you need to make sustainability in a hospital like ours as practical as possible. Drizzle it down to what everybody could do. And it starts with turning down your heater on the weekend. and very practical things in a daily life. And I think then people are not overwhelmed with climate change.
Thank you, Koonal.
I'm going to focus on persuading patients and the public and draw on the deliberative public engagement exercise that we did a few years ago. The general public participants who came into that, some of them were very engaged with climate change, but for the most part, they were skeptical of why this was the NHS's business. They were skeptical about why this was NICE's business. They didn't understand what this has got to do with healthcare. By the end of the exercise, they were much more in favor of it because they learned about the co-benefits that sustainable healthcare came. A lot of the time when they were presented with a sustainable healthcare choice and a less sustainable healthcare choice, they chose the sustainable one, not because of environmental concerns, but because they realized that it could reduce burdens on the healthcare system, or it would be cheaper, or it would be more convenient, or it would avoid them having to drive to a hospital. And those were the things that really mattered. So I think that would be my biggest tip for getting people on board.
Thank you. Wise words. Over to you, Omnia.
Yeah, I think it depends on which people are reluctant. What I've seen is with the general public, for example, the argument of the intergenerational injustice of climate change and how children and younger people are inheriting a world that they have not contributed to, are inheriting the pollution, the impacts on their health, both physically and mentally. And that's why some of the work that we're doing is actually integrating climate change and mental health in schools to teach children about how climate change is going to impact them, but also the mental health and psychological resilience tool to be able to cope with it and to be able to convince their parents, who are the ones that are responsible for their choices. I think when it comes to policymakers and the governments that we have the chance to work with, it has to be an economic argument, and the economic costs of climate change on healthcare, on people, and also the social injustice and the socioeconomic burden that people who are living at the front line also least contribute, but also bearing the costs, and also the economic benefits and the trade-offs of choosing a sustainable, greener, cheaper choice, like cheaper energy and cleaner energy, but also how it improves the overall health and well-being of the communities that they are entitled to. I think for healthcare professionals, the biggest argument is I personally have seen patients every day in Cairo with lung infections because of air pollution, and especially children and asthma exacerbations. So healthcare professionals are being asked now to respond to these impacts on health. It is driven by climate change, learning this in their medical faculties, but that's why it gives them a responsibility not only to treat the conditions that they are seeing driven by climate, but also not to be the ones contributing to why these conditions are happening in the first place.
Thank you. Yeah, I like the idea of the intergenerational justice and the healthcare professionals being champions. Over to you, Vasilios.
I think it was President Kennedy who said once that the greatest enemy of the truth is not a lie, because the lie you can fight it with the facts. The greatest enemy of the truth is a myth, which is rooted in people's hearts and minds, and you cannot get it out of there. So the only way to get the myth out of the hearts and minds of the skeptics, in my opinion, is to make them part of the process. Not just to tell them Armageddon is coming, you don't think green and sustainable, shame on you, get out of the room. But make them part of the process. If you want to relaunch a clinical pathway in the clinical setting, in the green and sustainable context, as I just mentioned before, get the colleagues who are skeptics about green and sustainable, or they believe it should be at the bottom of the agenda, part of the process. I think it will make a very, very big difference. And sometimes in life, we learn more from the people who disagree with us than from the people who passionately agree with us.
Thank you. I like the idea of inclusiveness, and we have a track on that, tomorrow. But we don't talk about climate change. But over to you, Jens.
Well, I could make it very easy. I completely agree to what he just said.
Yeah. You can add a comment. One comment.
I can add a comment. Okay, good. I thought many times about that question, and I find it extremely difficult. And for many years, I worked on the industry side and actually worked on diabetes. And I find the climate topic somewhat similar to diabetes, right, because you tell people about, exercise more, eat better food, stop, eating so much sugar, but people don't change because it doesn't hurt. So, and people don't die of diabetes, but heart attack, blood pressure, all these other things. And I think it's the same with climate change. You tell them about all these things that will happen if they don't change or adapt their lifestyle, but they don't do it until their, basement is flooded or they have been, hidden by a storm, because then all of a sudden it becomes real. It affects the person's self. So do I have an answer? Not really. I think what Lucia said earlier, I think education is one element, but it cannot be, just down to physicians, medical staff, and the healthcare system. I really believe it has to be a joint effort between, healthcare providers, policymakers, the industry, but also the public itself, talking about this topic from different perspectives, and also encouraging people that little changes in lifestyle, in daily habits can make a difference. Because I think that's what discourages many people, that they believe that their little contribution doesn't really count. But if there's millions of little contributions, it will make a change and have an impact.
It's important to keep that motivation high, because if we don't feel our little thing that we contribute to the whole system is ignored, we all stop doing it. So, but we obviously have to understand the systemic structural barriers to all of this and how we have to approach those firstly. So we're going to open it to the floor. So if people could put your hand up and introduce yourself and your affiliation. We have a lady here in the center.
Hi, thanks so much for your insightful thoughts. My name is Caitlin Norris-Gray, and I work in a biotech company in Boston. So I think you really clearly laid out some of the health impacts of climate change, but I'm just going to ask you a bit of a provocative question about the health impacts of chasing net zero. both on the patient, thinking about increasing cost of heating, maybe decrease social mobility, and also health inequality as we reach net zero, but also thinking about the healthcare and biotech industry as well, thinking about cost of manufacturing, supply chain, as we've mentioned before, and also how these regulations in the UK and the US will impact the attractiveness for the EU and the UK for investment, especially thinking as the US as competition, which doesn't have these regulations. And then finally, as a quick addendum, what do you think about AI and innovation as a huge source of carbon emissions?
Okay, you've packed a lot in there. Let's hold on to that one. Remember the question. Well, I'll take another question as well. The gentleman sitting next to someone in the middle with their hand being waved. A quick question. Don't make it a complicated question if you can.
Very simple question.
Please.
My
It's
name's
luncheon.
James Fleck. I'm at University of Edinburgh, a specialist in innovation and technology development, would you believe? My question is, it strikes me that misinformation is a huge problem, especially affecting the health sector. Are there any solutions that we can apply to that?
Okay, great. We've got a lot there. We've got misinformation, we've got AI. Who would like to answer? Who would like to start? Koonal?
Yeah,
For it.
on the point about the health inequalities, I guess what's important to remember is that many of the people affected by climate change are those who are also most affected by health inequalities. But both globally in terms of the countries that experience climate-related shocks, but also people living in sort of coastal areas or other deprived communities. I do take the point that this is going to be difficult, and for any one country or jurisdiction to do it alone will make them less competitive compared to other countries who are not doing it, which is why it is important that there is collaboration done across European countries, across other countries with similar healthcare systems, because we can learn a lot from each other.
Fabulous. Please, Omnia.
Yeah, just to add, because I just want to challenge the idea of that it is always a trade-off between sustainability and safety and cost. Because in many situations and more studies as well as interventions are proven to be, in terms of cost, cheaper, in terms of sustainability, better. Especially we're seeing even the global landscape of the energy systems, where now, according to the IEA, the report this year, the use of oil and gas is expected to peak before 2030, while the provision of renewable energy, whether it's solar, wind, is becoming way cheaper, and more countries, especially low middle income countries which have the widened health inequalities, are choosing to invest in cleaner energy because it is cheaper. And also the sustainability agenda in the healthcare system is not just about less carbon, it's also about patient safety. It goes in hand. It's about providing safer quality services to patients that do not burden them with the impacts of climate change and the impacts of carbon on their health. It goes hand in hand. And also with AI, yes, AI is carbon intensive, and this is why many organizations are trying to understand how can we move towards technology and AI, but not do it in a way that harms human health. And that's where the health community responsibility comes in, to really bring in how that impacts and how can we make sure it doesn't.
Thank you. Does anyone else want to add anything, or should we take a few more questions? Go.
If I make a couple of points. When it comes to the issue of misinformation, I think the answer is health literacy again, from primary school all the way to adult life. Not only talk about the young people about the body smoking and you need to use condoms to avoid sexual transmitted diseases, but an overall health literacy policy for health awareness from the beginning of life all the way to adulthood, I think makes a very big difference. B, for the AI can be enormously helpful, is not a demon as it is presented sometimes. It's just a tool, and there is nothing particularly intelligent about it. It's just another tool that we can direct it to go in one or the other way. It can be a massive help in helping us to coordinate everything that can lead us to a green and sustainable practice. One example is the redesign of the traditional operating theater we're doing at the moment that involves new technology, hybrid technology, HoloLens for education, use of diagnostics at any given time, teaching. All this is coordinating by AI and machine learning in a very efficient way and also very green and sustainable way. And the last point is net zero. and totally unrealistic target that will simply drive people crazy and probably the healthcare systems to their collapse. I don't believe so. It is a target. It is probably not a very realistic target, but at least you put something like this in front of you as a target, you will never get even close to that. If we say, let's see how much we can do, we will never do anything at all. You have the net zero target in front of you. At some stage, you will get closer and closer and closer to that. One of my PhD students who started just a few weeks ago, he asked me, what should be my target? And I said to him, your target should be to win the Nobel Prize. And said, is this a joke, professor? I said, it's not a joke at all. Because if this is your target, you will get 70% close to that. If your target is to publish a couple of papers, you won't publish anything at all, and your career will be over. So it is a driving force more than anything else.
Jens, can we take one more question and you can...
Well, I just want to say, because I found the question, why there's so many myths. I mean, I know it's going to be controversial, I'm going to say, but if the president of the United States stands in front of the United Nations and says climate change is the big lie, and let's not forget, there's many people supporting him, voting for him, believing in him, then it becomes very difficult for others to make it credible that climate change is happening and that it has serious effects. So we should not forget, where do people get information and what information do they believe? And the other one, I remembered AI. That was the last thing I remembered. I mean, when you think about, when you watch the news at the moment, what AI is supposed to be used for is weather forecasting. So they want to predict better, the storms, etc., that are coming our way. It's going to be interesting to see how AI is really going to be embedded in, sustainability management within healthcare. I haven't really seen that, because we use different companies for calculating the product carbon footprint for our clients. We used 3 different companies, gave them the same data. They came up with 3 different results. So probably the hospital would choose the one that has the lowest, because in terms of taxation, it plays out. So it's going to be interesting how AI is going to level that. So it doesn't depend on which company you go to. You will always get the same result, hopefully.
Yeah, the great reckoning of AI is to come. But I'm going to take one short question. If they promise to give a short question, the lady over here in the center, sorry, I'm biased towards the center, my eyesight. Very short question, please.
Yeah, my name is Sheena McCann, and I'd like to know why, or if anyone can address the issue of microplastics in health, because hospitals create a lot.
Yeah, microplastics. One person can only answer it, because we haven't got time.
It is real. It is real. It is grossly under-investigated. We have submitted a paper for publication. If I can have your details, I will send it to you once it is out. And there are many measures put in place to be able to reverse it. But again, not sporadically, but as a total redesign of a clinical pathway.
And sustainability, Economist Impact, we're having a whole session on this next year. Do come, I'm moderating. Thank you so much to our fantastic panel. Thank you to our audience. Okay.